Approximately 50 million Americans suffer from acne, and it's not just teenagers, but adults as well. There are different kinds of treatments that are now available, but which is the right one for you? It can be hard to work it all out and figure out what to do. Dr. Sunil Chilukuri, a board-certified dermatologist with Bellaire Dermatology Associates, joins us this morning to give us some good ideas. Good morning to you.
Good morning. Thank you so much for having us.
Well, we are glad you're here because it's something that probably affects everybody in some way, either themselves or somebody they know. So where do you even begin?
It really does, and I'm glad you brought that up. 80% of the world's population develops acne at some point in their life, so it affects all of us. So really, what can we do to just identify what causes and how we can stop it? And the nice part is there's a lot of things that are over the counter that we can do starting at the basic level, and we can talk about that.
Well, when you go and look, there are so many different products, it's hard to know where to begin. So I would think starting with a good cleaner is the first place to start, right?
Exactly.
Make sure you get as much bacteria as off as you can.
And the nice part, there's so many products that are out there that are working well. One is by Neutrogena, Cetaphil, CeraVe. They're all affordable. They range from $5 to $15, so we can all afford it. And you can start with a gentle cleanser that you do twice a day.
All right, and then we've cleansed. Now what do we do?
The next step is, depending on what type of acne that you have, if you do get the little bumps that we all get, and you can see I have one right here, so they are frustrating, you can use a benzoyl peroxide. That's quite safe to use. That's over the counter. You can get any type of brand that seems to work for you. If you're getting chest acne, back acne, then I actually use the washes rather than benzoyl peroxide creams.
And what kind of wash are you talking about?
You can use a benzoyl peroxide wash, and usually what that does, it kind of kills off the bacteria that are causing the acne.
And then again, that's just something you do over the counter.
It's over the counter.
Okay, let's say you try those two things and it's not budging and it's there, or it's even getting worse. What's the next step?
And that's the frustrating part, but that's where we can give you individualized treatment. At Bellaire Dermatology, we specialize in exactly treating what you have, and one of those treatments is something simple. It's a topical. It's called a retinoid. So we all hear about this Retin-A, whether we can use Retin-A, and the way that it works is typically the skin, for 28 days, it gets stuck together. And with acne-prone patients, it stuck together a little bit longer. With the Retin-A, it's actually breaking that skin and changing it every 7 to 8 days, so you're not building up that acne.
And are you treating it just in the area where you're having the problem, or is it just sort of all over to make sure it doesn't come?
I'm glad you asked. You actually treat the entire face, because our goal is always prevention rather than just treatment.
Yeah, and the people like that. Please prevent it. They don't want to have to deal with it. What about laser treatments? Those seem to be pretty popular. Are they working for acne these days?
There's fantastic treatments that we have today. In fact, one that came out on the market is called Aclara, like acne clear always. And one of those things you can do is you see a change within 24 to 48 hours. Plus, it encourages you to actually use the creams that you get prescribed, so it makes that acne stay away.
Excellent information, Dr. Chilukuri. Thank you for coming in and helping us, and hopefully people can look in the mirror a little more comfortably after your advice, right?
Well, thank you so much for having me. It's a pleasure.